Hello, everybody. Good evening. I'm RJ Srividya from 92.7 Big FM. We have a special show today, and we have with us our special guest for today's special show, and he is Dr. Robbie George. He's the head of department and consultant, vascular and endovascular surgeon, Narayana Institute of Vascular Sciences. Dr. Hearty, welcome to the show.
Thank you so much, Srividya. Great to be here.
Yeah, I'm really very excited to know about this very interesting topic because vascular and endovascular surgeon, that name itself is very rare to hear. Okay, so what is this varicose veins, Doctor? Can you please explain? Or
Sure.
the common thing that we hear about, vascular surgery and all those things.
Yeah. So vascular refers to blood vessels. So the blood vessels are the pipes or the tube, the plumbing system of your body that carries blood all around. And there are essentially two different large groups that we look at. One are the arteries, which carry blood from the heart everywhere. And there are the veins, which bring the blood back. And human beings are the only creature who stands on two legs. No other animal does that. And the consequence of that is that we develop disease of the veins in our legs, especially. And the commonest illness that we develop in that is what are called varicose veins. So varicose veins are when the veins become big, bulging, very prominent, painful, discolored. And this is something that is seen in a lot of people, and it's far commoner than a lot of people realize. So that's what is referred to as varicose veins.
Okay. So, doctor, just tell me, what age group is more prone to getting varicose veins? Or is the age factor an important reason for developing this varicose veins?
Great question. So varicose veins will often start at a young age, and typically for women, it starts during pregnancy or immediately after. So it can start at a younger age. Then as you grow older, the damage has in a sense started. And as you grow older, the damage keeps progressing. So often people will present at a later age, maybe in their 50s or even 60s or later, with varicose veins, which they have ignored for a number of years.
Yes.
Well, there's another bunch of especially young women who get varicose veins during pregnancy, after childbirth, and it doesn't go away and they come earlier. So these are the two common kind of groups, the large clusters that we see.
So how can we recognize that a person or a female has varicose veins? And how can she be treated? And what is the right age to get treated for this varicose veins?
Okay. So again, just to clarify, it's not just women who get varicose vein, men also suffer from it. But yes, women are more prone to it, and primarily because of pregnancy and childbirth.
Okay.
So in terms of symptoms, what you get is some patients get a lot of heaviness in their leg, pain. In women, this can be heaviness that gets worse during period time or around that. Sometimes they get a lot of discoloration and very prominent discolored patchy blood vessels in the leg. Occasionally, you can get bleeding from that. These are the more common and, in a sense, the less serious symptoms. You can get serious symptoms in terms of getting blood clots in the leg. You can get problems which are with wounds that develop over time. So there's a whole spectrum in terms of how varicose veins can present as symptoms. Often it'll be, a partner or somebody else has noticed that your legs are looking funny. What's that thing that's sticking out in the leg, which is often a prominent blood vessel. And sometimes patients first realize they have varicose veins when they have a significant bleed, when they injure a blood vessel and it bleeds significantly. So there's a variety of ways people can present to us with varicose veins.
Okay. So, doctor, what are the dangers of not getting treated for varicose veins?
Yeah. So in varicose veins, if we were to go back to what is happening, is that the blood that is meant to return to the heart from the legs is not going back the way it should. And it's all kind of pooling up in these blood vessels and pipes. When it pools up, it causes high pressure. And this pressure is what causes the heaviness, the aching, the tiredness, the symptoms. Worst case scenario, this pressure begins to damage the surrounding tissues, that is, this flesh around the blood vessels. This can land up with 2-3 different things that are worst case. One is you can get blood clots. And these blood clots, especially if they involve something that we call the deep veins, can have the potential, not obviously everyone, but have the potential to be life-threatening. Some patients land up with very severe varicose veins in that the whole skin around the ankle and the lower part of the leg gets completely damaged. They can land up with big wounds that don't heal for years, which can be very distressing for patients. The other dangerous thing that happens is sometimes patients bleed. If you get an injury, it's a pipe that is full of blood, which does not want to stop bleeding.
Okay.
So these are the three things that can be really troublesome for patients.
And there is a myth, or I don't know how to put it across. Is it hereditary that if my mother has varicose veins and I am also prone to get that, or how is it?
You're absolutely right. So it's not a myth. Unfortunately, it is a reality. So varicose veins do tend to run in families. So if mothers have it, children, especially girls, are more likely to have it. So it's not 100%. It doesn't mean if your mom had varicose veins, you will 100% get varicose veins. It's just that you're probably more likely to get that. It does affect the boys in the family as well, to some extent, but not as common as it is for women. But you can still get varicose veins without anyone in your family ever having had them. So you might be the first to start off a trend in your family too.
Okay. So what is the best lifestyle management that can be done to avoid varicose veins?
Yeah. So again, so varicose veins, like I said, is a disease of human beings who's standing. It's a consequence of us standing. So the one thing that you can do is when you get the maximum time you have trouble is when you're standing still for prolonged periods. You're not really moving around. So there is something we call the second heart, which is the muscle at the back of your leg. So whenever you move, this muscle works. So when this muscle works, it helps to push the blood that is pulled up there back up to the heart. So being active is the single most important thing. Avoiding prolonged standing in one place is what we recommend to people. But as a surgeon, that's what I do most of my life. But it's something which I would not recommend if you want to avoid varicose veins. Avoiding excessive weight gain. These are the few things you can do to prevent varicose veins from developing.
So, doctor, we have come to the last and final question. So, what are the best and different kinds of treatment options that we have for varicose veins?
Yeah, so treatment has actually really evolved dramatically in the last few decades. So earlier, the original treatment for varicose veins used to be open surgery, which was quite painful, quite difficult for patients to recover from. Today, there are very minimally invasive options available. So there's something like glue, which you can do literally as an office-based procedure. You come in the morning, get it done, you can go out. There's radiofrequency ablation, there is laser, there is injections, all of which are actually very minimally invasive. Now, what treatment is appropriate for an individual patient is something that your doctor would see and assess and discuss with you before you decide what's the right way to proceed. But certainly it's far, far less invasive than what used to be there a few decades ago.
Okay. Thank you so much, doctor, for giving us a wonderful insight about the varicose veins. And, last but not the least, what would you like to give a small message for all our viewers as well as our listeners about this varicose veins?
Yeah, thanks, Srividya, for the opportunity. And what I like people to tell people is that, varicose veins are a reality of modern day life. And if you do have varicose veins, if you think you have symptoms that are there, get yourself checked out. There are lots of options to sort out the problem. There is no reason for you to suffer with them. And if you think someone has an issue, especially an older person who tends to be more, not care so much about themselves, don't let it progress to a point where it becomes a problem. It can be sorted out quite easily before that.
Okay. Thank you, doctor. Thank you so much for your time. You have given us a wonderful insight about all the things which we have asked you to give us. And this was our special show. And he is Dr. Robbie George, Head of Department and Consultant Vascular and Endovascular Surgeon, Narayana Institute of Vascular Sciences. Thank you so much once again on behalf of 92.7 Big FM. I am RJ Srividya signing off. Thank you, doctor, once again for being in the show. Thank you so much. Thank you.